Special connective tissue, blood, general characteristics. Blood is a special connective tissue which has a fluid intercellular substance produced by cells other than blood cells, like liver and lymphatic tissues. Blood intercellular substance also lacks a fibrous component. Structure. Blood is formed of plasma 55%, contains three types of protein: albumin, fibrinogen, and globulins. Albumin is the most abundant of small size, while fibrinogen is essential for blood clotting. Both types of protein are formed in the liver. On the other hand, globulins of three types, alpha, beta, and gamma, are formed in lymphatic organs and other tissues. Blood elements 45%. These are erythrocytes or red blood corpuscles or RBCs, leucocytes or white blood cells, which are either granular, having specific granules in their cytoplasm, or non-granular, having only non-specific granules, and blood platelets. Development. Blood develops as early as 2 weeks post-conception in yolk sac mesoderm. Later on, in adults, blood elements are formed in hemopoietic tissues that include myeloid tissue as bone marrow and lymphatic tissue as spleen, lymph nodes, and thymus. Functions. The different blood elements give different function. Therefore, each blood element is discussed separately with its possible function. Blood elements. Several items have to be discussed in each element: its shape, how it appears, its size, its actual diameter, its structure, the structure of the nucleus and the cytoplasm with its content, its possible color, its lifespan, its number, and variations in the number, whether by increase or decrease, and its possible function. Erythrocytes or red blood corpuscles or RBCs. Shape. On surface view, normal erythrocytes show a smooth rounded contour with a central depression, while on side view they appear as biconcave non-nucleated discs. Erythrocytes tend to adhere to each other by their broad surfaces, forming rouleau appearance due to surface tension and charges on the cell membrane. Abnormalities in shape. This is called poikilocytosis, which is irregularity in shape of RBCs. Sometimes it occurs in certain types of anemia or normally in low percent. The RBCs may be oval, ovalocystes, spherical, spherocytes, or pear-shaped poikilocytes. Sometimes they have a crescent or holly leaves appearance. This is sickling of the cells, which is met with in sickle cell anemia. Size. The normal diameter of RBCs varies between 7 to 8 micron, with an average of 7.5 micron. Their thickness is about 1.9 micron. Few RBCs may be larger with a large diameter more than 9 micron. They are called macrocytes. Also, few of them may be smaller with a small diameter less than 6 micron. They are termed microcytes. Abnormalities. Variation in the size of RBCs is called anisocytosis. This could be detected by Price-Jones curve. Price-Jones curve is a drawing curve between the number of red cells and their diameter. Normally, in normal blood, its peak ranges between 6 to 9 micron. In microcytic anemia, there is less number of RBCs than normal, most of them having small diameter. Therefore, the high peak of the curve is near 6 micron. The reverse occurs in macrocytic anemia, where there is also less number of RBCs, but most of them having larger diameter, more than 9 micron. Therefore, the high peak of the curve is met with at more than 9 micron. Structure. RBCs are not true cells. They have no nuclei. The cytoplasm of each contains no organelles, but only a mass of hemoglobin surrounded by a cell membrane. The cytoplasm contains also a network of protein formed of spectrin linked with actin. This network may act as a cytoskeleton, maintaining the shape of erythrocytes. Abnormalities. RBC's cell membrane is affected by changes in the osmotic pressure. In hypertonic solutions, RBCs undergo crenation, that is, shrinkage, while in hypotonic solutions, as distilled water, they undergo hemolysis, that is, rupture of RBCs and release of hemoglobin. Hemolysis may be caused also by other factors, as ether, alcohol, bacterial toxins, and snake venom. Color. RBCs are greenish-yellow in color due to the presence of hemoglobin. They are acidophilic after staining with eosine. Also, they can be stained by other stains like Leishman. Abnormalities. Darkly stained RBCs due to excess of hemoglobin are called hyperchromic, while lightly stained RBCs due to less amount of hemoglobin are called hypochromic. Lifespan. It is about 120 days. Snail RBCs are destroyed by the phagocytic cells in the liver and spleen. The iron content is stored to be used once more for formation of new RBCs, while the pigment is excreted as bile pigment. Number. The average number of RBCs is 5 millions per cubic millimeter. In males, the number is greater than in females. However, it ranges in males from 5 to 5.5 millions per cubic millimeter, while in females it ranges between 4.5 to 5 millions per cubic millimeter. The less amount of blood in females is due to several factors: the monthly loss of blood during the menstrual cycle and other hormonal factors. Abnormalities. An increase in number of RBCs more than 6 millions per cubic millimeter is called polycythemia, Polycythemia may be physiological or pathological. Physiological polycythemia occurs in newly born infants after cold bath and muscular exercise, during emotions, and in high altitudes due to lack of oxygen, which in turn stimulates the bone marrow to manufacture more RBCs. Pathological polycythemia, on the other hand, occurs in heart and lung diseases, which lead to lack of oxygen. Decrease in number of RBCs less than 3 millions per cubic millimeter is called oligocythemia or anemia. It is always pathological. There are several causes of anemia and different types. For example, deficiency anemia due to deficiency of minerals like iron or vitamins as vitamin B12, or deficient healthy proper diet. Hemolytic anemia due to hemolysis of the already formed RBCs. Hemorrhagic anemia due to bleeding as it occurs in accidents. Aplastic anemia due to damage or disease of the bone marrow, which becomes unable to manufacture healthy RBCs. Functions of RBCs. Hemoglobin present in RBCs is responsible for gas transport, that is, reversible combination with oxygen and carbon dioxide. Hemoglobin carries oxygen to the different organs and tissues of the body and exchanges it with carbon dioxide, then gets rid of carbon dioxide by delivering it to the lung. Adaptation of RBCs to function. RBCs are plastic in nature, so they can change their shape and squeeze themselves in the narrow capillaries. RBCs are biconcave to increase the surface area for the exchange of gases. RBCs contain no nuclei or organelles, thus giving space for hemoglobin, which in turn picks up oxygen to form oxyhemoglobin. RBCs contain carbonic anhydrase enzyme needed for the carriage of carbon dioxide to form carbaminohemoglobin. Hemoglobin also binds carbon monoxide to form carboxyhemoglobin. This combination, however, is irreversible and reduces the capacity of hemoglobin to carry oxygen. RBCs contain soluble enzymes responsible for glycolysis and hexose monophosphate shunt in order to provide the cells with energy requirement, as RBCs possess no organelles or mitochondria. RHESUS factor or RH factor is an antigen which has been discovered in the RBCs of rhesus monkeys. It is also found in the RBCs of human persons in a percentage of 85%. Those persons who possess RH antigen in their RBCs are called RH positive individuals. Other persons who possess no such antigens are called RH negative individuals. When an RH negative person receives blood from an RH positive person, he will develop anti-RH bodies in his plasma. This is quite dangerous for the second transfusion of blood from RH positive persons. When an RH positive man marries an RH negative woman, the fetus will be RH positive. The first child will come without any complications, but during labor, some of the fetal blood RH positive will pass to the mother's circulation. The mother's blood will start to form anti-Rh bodies. In the next pregnancy, these antibodies will cross the placenta to be mixed with the fetal blood, causing hemolysis of his RBCs and intrauterine fetal death, a condition which is called erythroplastosis fetalis. For treatment of these mothers, they have to be injected after each delivery or each abortion with a preparation of anti-Rh. Comparison between leukocytes or white blood cells and erythrocytes or red blood corpuscles. Shape: leukocytes are spherical cells, while erythrocytes are rounded biconcave discs. Size: leukocytes' diameter varies from 6 to 20 micron according to the type. On the other hand, erythrocytes' diameter is from 7 to 8 micron with an average of 7.5 micron. There is only one type. Structure: leukocytes are true cells. They have nuclei. Their cytoplasm contains organelles, but no hemoglobin. Their cell membrane resists changes in osmotic pressure. On the other hand, erythrocytes are not true cells, but merely corpuscles. They have no nuclei. Their cytoplasm doesn't contain organelles, but only a mass of hemoglobin. Their cell membrane is affected by changes in osmotic pressure. Hypertonic solution causes crenation and shrinkage of erythrocytes, while hypotonic solution results in hemolysis and rupture of erythrocytes with a discharge of hemoglobin. Color: leukocytes are colorless, need to be stained. On the other hand, erythrocytes can be seen greenish yellow without any stain due to the presence of hemoglobin. Lifespan: leukocytes' lifespan varies from few days to many years according to the type of leukocytes. On the other hand, erythrocytes' lifespan is about 120 days. There is only one type of erythrocytes. Number: the total leukocytic number varies between 4,000 to 11,000 per cubic millimeter. On the other hand, the average number of erythrocytes is about 5 millions per cubic millimeter. It is greater in males than in females. Abnormalities in number: an increase in number of leukocytes called leukocytosis may be physiological or pathological. Physiological leukocytosis occurs in infants after meals, cold bath, and muscular exercise, and during pregnancy and lactation. Pathological leukocytosis occurs in acute pyogenic infections, usually accompanied by pus formation, as abscesses and acute
Decrease
tonsillitis.
in number of leukocytes, called leukopenia, is always pathological. It occurs in bleeding and starvation, exposure to irradiations and X-ray, prolonged use of certain antibiotics like chloramphenicol, and in certain diseases like influenza and typhoid fever. On the other hand, an increase in number of erythrocytes is also may be physiological or pathological, while decrease in number of erythrocytes, which is called oligocythemia or anemia, is always pathological, as in deficiency anemia, hemolytic anemia, hemorrhagic anemia, and aplastic anemia. Function. Leukocytes are related to defense mechanism and immunity. On the other hand, erythrocytes are responsible for gas transport. They carry oxygen and carbon dioxide. Oxygen to the tissues and carbon dioxide from the tissues to the lung. Types. There are two types of leukocytes: granular, having specific granules in their cytoplasm, and non-granular. Granular leukocytes are neutrophils, eosinophils, and basophils, while non-granular leukocytes are lymphocytes and monocytes. On the other hand, there is only one type of erythrocytes. Other features. Leukocytes show amoeboid movements, and they are found in blood, lymph, and connective tissue. On the other hand, erythrocytes show no amoeboid movements, and they are present only in the bloodstream.